welcome to Coronavirus What You Need to Know. This is our 8th live town hall program in the series. These programs are produced in association with the Sonoma County Department of Emergency Services, with input from public health agencies around the Bay Area, and many nonprofit organizations as well. Good evening, I'm Darren Lachelle, President and CEO of Northern California Public Media.
And I'm Adia White, Assistant News Director at Northern California Public Media, and your co-host for tonight's show. With so much new information to share, we have a packed show tonight. Our guests include Susan Gorin, who will have some news about Sonoma County parks. Health Officer Dr. Sundari Mace will join us in the studio to answer your questions, and we'll have a panel of healthcare providers who will talk about how prepared our hospitals are to handle the anticipated surge in cases. Darren Lachelle has the details on how you can submit your questions to the program. Darren?
These town hall programs give you the opportunity to ask public health officials, medical professionals, and elected leaders the questions that are on your mind. You do that by visiting the easy-to-use contact form on our website, norcalpublicmedia.org/coronavirus. The contact form can be found on all pages and news articles that deal with COVID-19 updates and information. And now, Adia, back to you.
Last week, the Sonoma County Board of Supervisors began a new mental health initiative and prepared to announce long-awaited action on our county parks. Board Chair Susan Gorin talked with News Director Steve Mincher on Friday afternoon.
All right, Susan Gorin, it's great for you to join us again. Thanks so much.
Thanks, Steve, for inviting me once again to be part of the virtual town hall.
All right, one of the things that came through this week that we're very interested in is the idea that Sonoma County has stood up what they call a mental health warm line. Now, the warm gives you a good warm feeling, and I guess it also distinguishes it from a hotline. It's not for emergencies. But I understand that if you call a number, that there's a mental health professional waiting on the other side. And tell us why the Sonoma County felt that it was necessary to do that at this time.
I can imagine how stressful it is for everyone in Sonoma County, actually throughout the world, to be sheltered in place at this time, nervous about how the COVID pandemic is moving through your community, fearful about the transmission that may be occurring through people that you know. But I also know that it's very, very stressful for families with children, with extended families, all sharing a space, competing for resources, perhaps one computer for distance learning and working, and nervousness about being without a job, without a paycheck, and certainly a concern about where to get food to feed the family. This is an opportunity to call this number to get professionals, trained professionals on the other end of the line to help lead you through this crisis, to give you a better feeling that indeed we will move through the pandemic stronger than ever. And even the best of us need a friendly voice on the other end to say, what you're feeling is absolutely human and natural. We get it, and your stress and challenges are shared by many in our community.
All right, Susan, let's put that number up on the screen here. It's 707-565-2652, and I understand that's going to be manned and womened from 10 a.m. to 7 p.m., 7 days a week. You know, one of the things that struck me when I read about this was the fact that not only are the folks waiting to hear from you, but if you have a friend, a neighbor, a loved one who you think could use a call from a trained mental health professional to put them at ease, you can also give that number and they will call out to your friends, neighbors, and loved ones.
That's really important when someone is in crisis, feeling despondent, wondering how they're going to emerge through this. They don't recognize that they actually are in crisis, and they don't recognize that there are resources available for them to reach out to. So if you know a family member or a neighbor that is suffering from the challenges of going through this pandemic, if they're despondent or if they're experiencing any sort of mental challenges, inability to cope please contact the number on their behalf, and we will have one of those trained professionals reach out to them.
Well, that's really great. Now, in terms of really taking the pressure off, we have so many questions, and I can read you one from a listener who has been writing to us, and they asked, why are safe activities restricted? Things like hiking and biking and walking and getting out into the parks. And I understand there are some changes in the park guidelines that are coming. Can you tell us about those?
So many community members have outreach to the supervisors and certainly the elected council members. We want access to our parks. It's part of our normal experience living in beautiful Sonoma County, surrounded by state parks, regional parks, and city parks. Why can't we use those facilities for recreation and exercise? We have heard you, and we've been advocating for this to happen. Now, it's going to be a soft opening. It's going to be a loosening of restrictions. It's not going to be a totally open park for you at this time. What you can do is walk through the park, walk across the grass field, lie under a tree perhaps, and bicycle through the park. What you can't do is to use the park or to access the park with your vehicle. So you'll have to find the closest park to your house so that you can walk or ride your bike to the park and through the park. It varies. Some of the city parks will have their restrooms open. The regional parks may not have the restrooms open. Playgrounds, picnic areas, youth sports will not be available yet. We're trying to gauge how to navigate through the loosening restrictions of the parks to make sure that COVID transmission does not spike. We don't want to endanger your health or those around you. You will be required to wear a mask in parks to the extent possible. I know that it's uncomfortable if you're running or riding a bike, and it may be less concerning that you have a facial covering then, but we do want the folks around you to feel safe. And that means they want to see you in a facial covering. Our beaches, our beach parks, and Tole Regional Park will not be open because those are parks that you can't easily ride your bike to or walk to. We want you to really focus on accessing those parks that are within 5 miles or very close to where you live.
Well, that's really great news, Susan. And I know that right after this broadcast, a few hours afterwards, I know we don't want people going out there in the middle of the night, but tomorrow morning, Wednesday morning, people will be able to go out in the parks. That's great news, and thanks for bringing that to us. And thanks for joining us again on the broadcast, Susan Gorin, Chair of the Board of Supervisors.
Thank you, Steve. It's always a pleasure to communicate and articulate some good news to our community. We've been through a lot. It will get better. We will be stronger. Please be patient.
Santa Clara County Public Health Officer Dr. Sarah Cody was launched into public view when she ordered the nation's first shelter-in-place order. Last week, she announced that the first death from COVID-19 in the United States actually occurred in early February in Santa Clara County and not 3 weeks later in Washington State, as previously thought. Dr. Cody took time out of her busy schedule to answer questions during a San Jose Spotlight hosted Facebook Live event. Our South Bay reporter Pamela Lawrence has that and other recent news from the region.
Last week, San Jose police reported several Asian-owned businesses suffered a string of vandalisms where the suspect smashed glass doors and windows. While this incident hasn't been declared a hate crime as of now, Asian Americans and Pacific Islanders have reported an increase in coronavirus-related discrimination. Recent data from the Stop AAPI Hate reporting site describe nearly 1,500 incidents from across the country, ranging from verbal harassment to physical assault and vandalism. California and New York rank among the highest numbers. Individuals who experience hate as a result of COVID-19 are encouraged to report them at stopaapihate.org. Back on March 16th, residents from 7 Bay Area counties were ordered to shelter in place, the first such order in the country since the start of the pandemic. Santa Clara County Public Health Officer Dr. Sarah Cody led the group of health officials that made that bellwether decision. Governor Gavin Newsom followed days later with a similar order for the entire state. Dr. Cody's early and decisive action helped flatten the curve in California. She joined the online news publication San Jose Spotlight last week for a Facebook Live Q&A. The predominant question from viewers was why Santa Clara County hasn't mandated face coverings like many other Bay Area counties. Here's her answer.
So first I want to say that our county, Santa Clara County, is 100% aligned with other counties and with the state in recommending wearing a face covering. So I'm not covering my face. I'm really just covering my nose and mouth where I might be shedding virus. So we are completely aligned. And our strategy here was to not make it a health officer order. So a health officer order is a legally enforceable order. In other words, law enforcement can come and take action if you're not complying with the order. And I was thinking about this, and one, law enforcement has a lot of priorities for enforcement, and I didn't want to take enforcement resources away from other things towards people wearing face coverings. And the other is, when I issue a health officer order, I mean it.
Just over a quarter of Santa Clara County's population is from the Latinx community. It's a population that Dr. Cody recognizes as being overrepresented among cases and among deaths. She described how this was being addressed.
We're addressing this in a few ways. One is we have now a outreach effort wanting to ensure that communities understand the risks of COVID-19, how it's transmitted and how they can protect themselves. But at the same time, we also understand that in communities, there are structural reasons why it is difficult to shelter in place. So what we are hoping to do is to protect all communities by having everyone shelter in place, by having less virus circulate in the community, and then by providing supports as we can to help people isolate.
With case counts coming down to, in Dr. Cody's words, a manageable number, a question on everyone's mind was when the shelter-in-place orders would be lifted.
Our population is not immune to this virus. So essentially, the whole population in our county and in the region and in the state and else, really around the world, it's like a tinderbox. And so if you think of every new case as an ember that drops into the tinderbox, a fire can certainly light. And that's what we want to avoid. It's caused incredible economic disruption and social disruption. And many people and many families have made enormous sacrifice. And I do not want to squander the sacrifice that everyone has made. I want to hold us where we are and do whatever I need to. At the same time, I do understand that there are health impacts of the shelter in place, and we're endeavoring to understand those as best we can and navigate our way towards whatever it is that's most health protective, that protects the most people. That's the way that we're going to go. And I think that means that we are not going to return to our normal way for a very long time.
Please share your questions with us so that we can get answers for you during these live town hall programs. Visit the easy-to-use contact form on our website at norcalpublicmedia.org/coronavirus. Fill in your question, share your name and email, and select the subject of your question, and then click Submit. The program is being translated in Spanish live right now on La Mejor Radio 104.1 FM. We'd like to thank our friends at La Mejor Radio for their partnership on these town hall programs and also for the service they provide to our community. And now here's Adia White with Sonoma County Public Health Officer Dr. Mace.
All right, we're in the studio now with Dr. Sindri Mace, who will be answering some of your questions. So thank you so much for joining us again.
Yeah, thank you for having me.
So before we get started, let's go over a quick update about the number of cases we have here in the county.
Okay, great. So actually globally, we're above 3 million cases, and we have 217,000 deaths. And here in the United States, we actually have 1 million cases and about 58,000 deaths. So that has kind of increased quite a bit since we last talked. In Sonoma County, we've added 5 cases since yesterday, putting us at about 227 cases, and I think we still are at 2 deaths. So that's the update from the epidemiology. We do have some new modeling data that we can discuss as the questions come in.
Right, so we're seeing a lot fewer hospitalizations than we initially expected. What does the new data tell us about when we might hit a surge in cases?
Well, you know, it seems like shelter in place has been incredibly effective. And I think that's really the main message that we have from the new modeling. It looks as if it was much more effective than even the modelers predicted. So we thought that the shelter in place would reduce transmission, that is from one person to another, of the virus by about half. But it's actually more like 75% reduction. And that's why we've really flattened the curve. And we're not seeing nearly as many hospitalizations or cases as we once projected.
Right, just an initial look at the model, it seems as though we're going to hit a surge much past we initially thought in June, right?
Yeah, and in fact, if we kept shelter in place, which by no means are we planning on, we're planning on loosening shelter in place moving forward, we would probably not see a surge at all. And so we just have to see over time, as we loosen shelter in place, if we can ramp up some of our other strategies, like say, for example, the contact tracing that we were talking about, the intensive case finding, contact evaluation, and isolation of cases, quarantine of contacts. That's going to really help in the long run.
And during your afternoon press update, you mentioned that you were planning on increasing contact tracing. Can you talk a little bit more about your plans to do that?
Well, right now, our disease control nurses follow up with all of the contacts to our cases. And we have people, volunteers at home, that are actually calling the contacts every few days to see if they're going to become symptomatic. And we test all of our contacts at about 7 days after they are initially identified. And what we're planning to do is scale that up. So as we have more cases, which I think we'll probably see more cases with the opening of the parks. So as we have these more cases, we will follow all of them up, and we might need an army of contact investigators to respond.
Any plans to increase staffing at this point?
Well, we are pulling in people from other departments. So we are calling on nurses from other departments as well as other county employees to step up for the contact tracing effort.
And we can certainly dive into the modeling data next week as well, but I think the big announcement we have this week is that you've loosened restrictions on some Sonoma County parks. Can you talk more about what people should expect?
Yeah, so actually now you'll be able to go into your local park. You can walk, bike, jog, or any way that you can get to the park without driving, essentially, as long as we maintain the social or physical distancing of 6 feet. You need to carry with you a facial covering. You don't need to wear it unless you're at risk of being closer than 6 feet to somebody. And you can go in and enjoy the parks and the trails. No playgrounds at this point, no going off the trails, no mass gatherings of people, no picnics, none of that yet.
Right. So we did get a number of questions specific to the parks order. First of all, for those who are handicapped or disabled, will they have to walk or bike into the park, or will they be able to go in?
Well, you know, there's actually a number that people can call. I can give that number to you, and you can put it out on your website. If someone's disabled and needs special assistance, they can call that number.
Great, but for now they are able, if you are handicapped or disabled, you can use the parking lot, is that correct?
I think you need to call the number and see what they can arrange, but there will be special arrangements for anybody who's disabled.
Okay, and so if park restrictions are eased, how is the county going to ensure out-of-county people do not flood into the parks during the lockdown?
Well, that's the reason why we're not having anybody drive. So parking lots are all closed, and you could actually be cited and fined if you drive to a park and park on the side streets and all. So we're really trying to limit the overcrowding, and we will definitely revisit this. But that not driving will also ensure, I think, that we don't have out-of-county people coming from long distances away.
Right, but if you live near the park, then you will be able to walk or bike in.
Absolutely.
And what about beaches?
Beaches are closed this time for the same reason, that we don't want to see a lot of overcrowding. And we know that our coastal beaches are often frequented by people outside of the county and the region, people coming in from all over. So initially, we're going to have those be closed and only have access to the other parks that are not coastal at this time.
And what criteria will you look at before you start allowing people to the beaches?
Well, you know, that's a really good question. I think we want to see over the course of the next 2 weeks how many people go into the park. Are they able to actually social or physically distance? Are we having areas where we think there might be risk? And our Parks Director, Bert Whitaker, and his crew of park rangers are going to be very careful in observing all this and reporting. Additionally, we'll see if we have more cases. And I think probably as we loosen up on any of the shelter-in-place restrictions, we are going to see more cases.
Right, and we have seen that community transmission is down at this time. Are you concerned that that could possibly go up once we lift these restrictions?
Well, you know, shelter-in-place was so effective at limiting and totally interrupting community transmission because everybody was at home. So I would think the corollary, when people start going out for activities, even such as the parks that are outdoors and potentially lower risk, I think we will see more community transmission. And we'll just have to follow that and see how we respond. But if I can ask people to really try to abide by the social distancing, if you go to the park and there's hundreds of people there, I really advise that you go back home and decide to visit the park another time.
And what about restrictions on other businesses? Have you talked about kind of a soft opening of some of those as well?
We're looking at other areas. Construction is one of the considered essential businesses, and we are loosening some restrictions there. So we're deliberating on a few other areas that we could open up, and we will have the shelter-in-place extension for Sonoma County out this week.
Wow, so that's some big news there, because I know a number of Bay Area counties did already extend their shelter in place, so we're expecting to see that extension this week.
All right, we're going to have our very specific county specific order out this week.
We did have a number of questions about whether or not it would be extended past May 3rd, which I think is fairly evident, so I just want to make that clear to our viewers right now, that it will in fact be extended and not to expect anything to be lifted before then.
Right.
So diving into some other questions here. Is Sonoma County Public Health conducting contact tracing for every contact of people who are tested positive for COVID-19?
Yeah, and that's an excellent question. We are actually identifying every contact to a case that had significant exposure. Now, it's usually people in the household who are the contacts that are having a lot of exposure. And we're not only identifying them, but as I said, we're testing them all, whether they have symptoms or not. And that's been really effective. And that's where we've been finding most of our cases in the last several weeks. So if we put in a program by which we go after every single contact of cases, plus asymptomatic high-risk groups like healthcare workers and first responders and our older folks, then that's going to help us when shelter-in-place is completely loosened to continue to flatten the curve. So we are going to need a lot of resources, and every contact will definitely be traced and tested.
All right. And so speaking of testing, does the number of tests performed in the county so far on the dashboard, again, socoemergency.org, you have the number of tests listed there. Does that refer to the number of people who have been tested, or is more than one test sometimes used on one person?
It might be occasionally more than one test, but on the whole, that reflects the number of people that have been tested. There may be some instances where a person's had 2 tests.
Okay, but that would be fairly rare.
It would be rare, right.
Okay. So another question about community transmission. I keep hearing that there is low community transmission, but as far as I know, you can't just get a test if you have symptoms, and you're mostly testing people with COVID-19 who have had contact with someone with COVID-19 or have a high risk for infection. So do we have enough data to know that there is in fact low community transmission?
Well, as of this last weekend, we've been much more widely testing. So we performed 480 tests on Saturday and Sunday combined, all on healthcare workers who were either symptomatic or asymptomatic. My impression is that most people were actually asymptomatic. And we're continuing that testing. And we will be extending that testing to our priority groups as we've allocated. So first responders will be next, people over 65 and people with underlying medical conditions that are symptomatic after that, essential infrastructure workers who are symptomatic after that, and then the general community who have symptoms. So I think within the next several weeks, we'll be seeing widespread community testing as well.
Wow. So how did that go over the weekend?
Fantastic, very seamless. Our disease control nurses set this all up. Julianne Ballard, who was on the TV doing an interview, explained that we had 3 different testing stations and we had appointments. People had called to make appointments, so there wasn't a rush. It was all just very fluid. People drove in and had their swabbing done and drove out, and there was no congestion at all. And we were able to do 250 tests on Saturday, 220 on Sunday.
And again, you said you're going to soon be opening this up to some broader groups. What can you specify the next group that this will be opened up to?
Right, so after healthcare workers, it'll be first responders, both asymptomatic and symptomatic first responders.
And we're still waiting on a number of test swabs that are supposed to come in and help us expand that further. Is that correct?
We're waiting for the 100,000 swabs that we put in for an order through McKesson, which is a company that produces the swabs. And I'm hoping we'll get those in the next couple of weeks.
Which would again help us eventually to expand to community members who are symptomatic.
And that's how we're going to reach that goal of 600 to 800 tests a day. And we're going to pull in our clinic partners as soon as we have all the swabs necessary. They can also do 200 tests. And actually, we're going to have the state start 2 testing sites in Sonoma County starting next week. And they'll be able to do 130 tests in each site also per day. So we're really ramping up with the help of the state of California also at this time.
That's some exciting news. So they will have their own sites that they'll do that at?
Right, and we're just choosing the locations now. And it'll be completely insular in the sense that they'll have their own swabs, their own testing personnel, their testing materials, and their own laboratory. So they will be just doing those tests for us free of charge.
Will they be deciding the criteria as well?
No, we'll decide the criteria. So they'll follow our criteria.
Okay.
And so we can tell them we want this group tested at this time, and they'll be able to do that for us.
Wow, so I'm imagining that will start with first responders then?
Probably by next week, I think we'll be getting there. Again, I don't have an idea of how many healthcare workers actually are calling in, but I do know that our appointments are completely booked at this time.
Right. And again, why did you start with healthcare workers?
I think they're the highest at risk individuals, and we've also had a lot of cases amongst healthcare workers, especially early on when we're seeing more transmission. And so we thought that because that group is most exposed to people who could have COVID, that we should start with them.
So next question, we've heard that a number of clinics have been canceling elective surgeries and non-emergency surgeries. So this person says they're a heart patient and have been waiting for a surgical procedure. When will Sonoma County allow non-emergency surgery?
You know, actually, we're discussing it right now. The governor has actually put out a statement that our hospitals can start considering elective surgery as they see fit now. And I know that all of our hospitals are looking at that. From the county perspective, I think it's fine. As long as we don't have a need for all those hospital beds, I believe that the hospitals should start with what they consider to be elective surgeries that are easily doable, where patients won't end up with long ICU stays, that they can reverse doing right away. In other words, if we have a huge need for beds, they'll need to be able to go back to surge capacity in a short notice, but we're working on guidance with the hospitals right now to put out.
Is that in part because it looks like we're doing really well in terms of our capacity at the moment?
Right, so again, I've spoken about the modeling at length with the media, and let me just say we can go over that next week in great detail. But basically, at this time, we're not expecting that huge surge. We have mitigated that surge. We've basically flattened the curve to a great extent with our shelter in place, that we've put that surge off significantly. And so we're not expecting it. So the hospital should move forward with helping people who really need elective surgical procedures at this time, I think.
And we do also have Sonoma State, which is supposed to open up its beds tomorrow, I
That's
believe.
right.
So what are the plans for using that facility?
Right, so that's going to immediately start housing people who are pending tests. In other words, you've had a COVID test, but you don't have the ability to isolate yourself anywhere. They can go to the dorms. That will start tomorrow, in fact, and I think we already have some referrals in place. It's also going to be soon accepting all the COVID positive persons, and they'll be going to the gymnasium. There's a large gymnasium that can house some 70 plus people that can be cohorted there, meaning that they'll be there with other COVID positive persons and be able to have some medical care and monitoring.
Right. So that will be really useful, I imagine, for people who are, with their family. And what about if they just have symptoms but aren't, confirmed to have COVID-19? Will they be able to potentially go there as well?
Yeah, definitely. So that's the whole point. Is as shelter in place is loosened, we basically want to make sure that cases of COVID are not infecting other people. And that would include even their own household members. Because that's where we're seeing a lot of the transmission, is from one household member to all the others at this time. So if we can put in a process by which people are isolated outside of their homes in the dorm rooms at SSU while they're infectious for that 7 to 10 day period, or even longer if they're symptomatic, then their household members could be protected.
And I'm sure we'll be following up on what that looks like, how it's going next week as well.
Right.
So this next question we got originally in Spanish, and it was translated into English. So I just want to remind people that if you're listening on La Mejor right now, we are accepting questions in Spanish, and we can translate those for you. Again, you can submit a question on norcalpublicmedia.org/coronavirus. So this next question is, how do we treat kids who are younger than 3 and have coronavirus?
All right, so luckily, we're not seeing a lot of cases in that group, and maybe because they're not symptomatic, and we're not at this point testing asymptomatic children, but we treat them exactly the same way as adults if they came to light and they had a positive test.
Okay, so if you have, a child you're concerned about, is there anything that you can do specifically to kind of ease their case, make life easier for them?
Well, they can get fever-lowering medications if they have a fever. If they have nausea, they can get medication for that. And they should also, if they're coughing and all, they should be isolated with their parent, probably at that point, until they're considered non-infectious. But again, we do think that kids largely are asymptomatic, so we're not seeing that a lot, that circumstance come up.
I imagine there's a lot of worried parents out there whose kids might have a cold or something, and they're concerned that they have coronavirus or whatnot. So,
and it might be worth, as we're starting to test symptomatic persons in the community, start to test kids who are symptomatic too.
But still, at this point, we've had very few kids, it seems, in our county, at least, get coronavirus, although it is happening for people.
We've had a few young kids, but largely it's been that 18 to 64-year-old group, 19 to 64-year-old group that have been our cases.
Okay, so this next question again has to do with flattening the curve. Given that the original goal was to flatten the curve and prevent surges, what level of hospital capacity is acceptable at this point?
Right, so I think our hospitals are prepared. We would be able to scale up for surge capacity to meet the bed needs per our newer modeling from the state of California. So I think we're prepared at this time with the hospital beds.
And I think this question also is getting into the state's criteria for lifting shelter in place, right?
Right.
So it seems like we might have met that criteria according to the state.
Well, we are constantly reassessing our surge capacity. The one thing that we do need to note is we may need more ICU beds and more ventilators. So in those two areas, I know our hospitals are very busy planning and working to ensure they're getting the ventilators that they need. But in that particular criteria, we may not have yet met surge capacity. So we're working on that.
I see. And that's just, again, because of ICU beds and ventilators and making sure that we have enough of those materials specifically.
That's right.
Okay. And what about some of the other criteria? Are we making progress on meeting those as well?
So we've talked about the testing and the intensive contact tracing, case isolation. As far as keeping our vulnerable populations safe, that's the older folks, older than 65, in the congregate settings, and medically vulnerable populations. I think we've done a pretty good job of that. We're still doing the surveillance testing in the congregate settings, and we haven't found any cases among residents in skilled nursing facilities at this time, which has been a big problem in other counties. And then there is the therapeutics, but that's at a state and federal level that we're looking for a vaccine or treatments. And we are working with different businesses and entities to try to establish plans, best practice plans for when we do open, for social or physical distancing and facial coverings and temperature checks, symptom reviews for employees as we move towards potentially opening.
And you're doing a number of other surveillance programs as well, for example, within the homeless community and within jails. Is there anything to report on those as well?
We haven't found anybody through our surveillance in the homeless shelters that have been screened. I think all of them have actually been visited and a representative sampling of people screened. And in the jails, nobody turned out positive either. So those activities are also happening. The sixth criterion of the governor was to make sure we know when we would need to put back restrictions. So for that, we are going to closely monitor what happens as we loosen our restrictions and see if we're having a lot more cases. And I do predict that as we loosen shelter in place, we will see more cases.
Okay, so I think going over the criteria kind of answered this next question, but I'm going to read it to you anyway to see if there's anything else you might have to add. Why do we need to tighten shelter-in-place restrictions when hospital use remains at a small fraction of capacity?
The tightening of hospital use?
So why do we need to keep shelter-in-place restrictions when hospital capacity remains at a small fraction of what we expected?
Right, so shelter in place has been very effective in doing just that, reducing the numbers of cases, hospitalizations, and definitely for saving lives, as we only have 2 deaths in our county altogether. So that's why we're very gradually moving towards loosening the restrictions of shelter in place so we can track exactly what happens as we do that and know when to sound the alarm if we have a lot more cases.
So that's an interesting point that you bring up. Maybe it might be obvious to you since you obviously work in this field, but that's a reason why you might do this slowly, right? So you can see kind of how the opening up the parks to the community goes over the weekend, and then if we see kind of a surge of cases after that, we'll know that we're not ready to ease up on restrictions. Is that correct?
Yeah, that's a good way of putting it. In fact, most of the counties don't have as many parks as we do. We have like 80 parks and beaches, and a lot of people come from different places to visit our parks. So that's unique to our county. And that's why early on we had done the hard closure of the parks. So that's an area that I'm really interested in seeing what happens when we open. And we're trying not to do too many things at once, because then we won't be able to tell what the impact of one thing is, like the opening of the parks.
Right. So we also have a lot of questions in about weddings. Everyone's trying to plan their wedding for the summer, it seems. This person has one planned for mid-June. Will it still be able to take place?
Yeah, I mean, I think at this point we're really not looking at large gatherings for the summer. I think it's safe to say the governor's order restricts those. So I want to remind people that we're still under the executive order from the governor at the state level that pretty much restricts most of those kinds of things, like all weddings, mass gatherings, anything over 10. I mean, that's all in the executive order and not really up to our county.
Right. So it's pretty safe to assume you should probably cancel your summer wedding.
In all likelihood, as the governor's order is in place.
Right. Okay, so we have a few more questions about antibody testing. We talked extensively about this last week, but how are those, how's the machine that we ordered coming in?
Yeah, so we are waiting for getting the testing, and we have to quality assure anything that we get. So we are validating the process. I think I'm hoping in the next couple weeks we'll be able to do that antibody testing. But I want to really clarify that the antibody testing is more for surveillance purposes. It's not going to be for diagnosing people who have COVID, because that test really isn't very good for that. It's more for looking at who may have gotten infected over time previously. It won't be as good for the test we're using now for diagnosing COVID.
Right. And again, we're waiting on that to come in still. So this next person wants to know, is it safe to use a pool in the apartment complex? This is the last question.
Yeah, at this time, I believe that we are not advising using any kind of pools at this point, because that's not, at this point, not part of the order. I mean, to use community pools where many people could be at once. Right. We're not opening pools.
That makes a lot of sense. Well, thank you so much again for joining us, and we look forward to having you again on the show next week.
Good, thank you very much.
All right. So thank you so much again to Dr. Sundari Mase. She joins us in the studio every week. But we also have a number of questions that come into our newsroom that are directed at organizations that deliver health to county residents, like Kaiser Permanente, Sutter Health, and Santa Rosa Community Health Clinics. Executives from these organizations sat down with News Director Steve Mencher yesterday.
Now, there was, over the last few days, some reporting in the local newspaper that some nurses had been asked specifically whether they had contracted coronavirus at their workplace in order for them to be able to get workman's compensation. And I know that was a concern with some of the nurses. Dan, can you tell me the situation at Sutter with this? Because we have heard from many of our listeners that this was something that was very concerning.
Yeah, so this is always a question of where an illness may or may not have been contracted. And I can't speak to any specific or particular situation when it comes to that, because each situation is unique. But I can say that at Sutter, we're taking a much more conservative approach to that than the law even would require in terms of interpretation of whether something had been acquired at work. We largely are deferring to presuming, for staff who have been working here in the hospital, presuming that it likely had been acquired at work. But we do a case-by-case assessment of each and every factor, because each and every staff member's job function and things that they're doing are very different. But we are greatly exceeding the requirements of the law in terms of trying to be generous and supporting our employees and largely presuming workplace exposure.
And what about at Kaiser? Has that also been the case? I know there has been some question there.
Very similar to as Dan outlined, we take each case very seriously, and each individual's privacy is obviously of essence to protect. So each potential exposure employee would work with our employee health department, and they would do all the appropriate review of the details regarding exposure, ensuring proper and timely testing, and also recognizing that each and every one of us are taking care of loved ones at homes. And so we need to be thoughtful about that. Do they have the PPE they need to be safe at home, not just at work? And so really working to ensure that we have a sustainable process to keep both our employees and our community healthy.
Naomi, can you tell us what you've been hearing from others who lead community health clinics, whether people are finding their way to those clinics, whether they're finding help in all the languages they need, whether our undocumented neighbors are finding the help they need? Tell us, give us a bird's eye view of what's going on in the community clinics right now.
Yeah, I think it's a mixed response in terms of our people coming and finding what they, reaching out for what they need. Because yes, absolutely, we provide services in multiple languages. A majority at all our different health centers have bilingual Spanish speaking staff and physicians and other providers, nurses. So we're very accessible in terms of language. Everybody has a sliding fee scale, which for all of our telephone visits, everybody is waiving. So there's really no fee for anyone to come. And I think actually for all of our visits, even in person, we're waiving the sliding fee because we want people to get the care they need. That being said, people are afraid and they are still uncertain about whether there's going to be a cost, whether there's going to be safe. And so we're doing our best to reassure people about that. We send text messages to our patients, advising them of the services available and in English and Spanish, and trying just reassure people that they shouldn't delay important care and that we're here for them.
One of the main things we talked about at the very beginning of this, 8 weeks ago, when Dr. Mace came in and talked to us about flattening the curve, was whether we had enough capacity in our region, in Sonoma County, to take care of all the people we needed. So where are we at with that right now? Are we feeling, at Kaiser, at Sutter, are you feeling like if things go along the way they seem to be going now, that there's going to be enough capacity in hospital beds, in ICU beds, in ventilators? Do we have what we need here in the county? Tarek, would you like to take this first?
Yes, I do want to credit the county for really leading the efforts, and we are very pleased with the surge planning efforts that the county and of course we at Kaiser Permanente have made, both in Marin and Sonoma counties. And importantly, in terms of how we have flattened the curve, I go back to essential awareness, shelter in place, and protection. I do want to also call out one of our most vulnerable populations, which is our elderly who live in residential board and cares, who may live in skilled nursing facilities. They may live in low-income elderly housing. And really importantly, we found that, like with anything, prevention is key. And so one of the things our team has done in partnership with many of our partners here on the Zoom is a strike team to go see those residents in those board and cares early, to identify those who may have symptoms early, to be able to get them to treatment early, and certainly, and most importantly, to make a big impact to prevent a surge, is to make sure they get timely treatment and, of course, prevent, to the extent possible, an outbreak in any of these facilities.
Thank you, Tarek. Now, Dr. Weil, do you feel comfortable that if things go along more or less the way they have, that you will have enough emergency capacity in your emergency room to take care of any folks who are coming in?
Yeah, of course, I don't have a crystal ball, but everything we've done so far, first of all, we're operating well within our capacity right now, and that includes our hospital beds, our ER capacity, our ICUs, our ventilators, all well within our capacity right now. We have robust plans if things change. We have within a very short time, we could ramp up our capacity in the hospital. We have a tent set up waiting to go in the front of the hospital if we need that for additional ER capacity. So we have plans in place, but the work that's been done by public health in Sonoma County, it really looks good. I'm cautious, but I am optimistic that we're in a good position to continue going the path we are and to be able to manage what we have.
And finally, Dan Peterson, in the minute or so that we have remaining, are you feeling comfortable that we will be able to handle things, especially at Sutter, at your facilities?
Sutter Santa Rosa Regional Hospital is a part of a large system. And so our surge plan is really this hospital being a function of a very large system capacity, where we've put in plans in place to be able to surge between facilities. We've trained staff, a number of staff from other facilities as an integrated system, both inpatient and outpatient staff. We've sent a number of staff out to Sacramento to our Sutter Health University, which is another name for our internal training center, to train them to be able to flex into the hospital and help in our med-surg units and our ICU units. And we've done really a lot of things over the last few weeks, which we would not have been able to do had we not had these intervening weeks to prepare. And so we do feel that we're in a much better place than we would have been had this all been a surprise for us, because of the work that we've been able to do.
Remember, these virtual town hall programs are built around your questions. We are looking for answers to your questions. So if you've been on our website to submit a question and it didn't work or you couldn't get through, please try again. We've had a lot of people submitting a lot of questions for these programs. So do refresh the screen and give that a try one more time. Now, coming up next, Assistant News Director Adia White speaks with California Assembly Member Jim Wood and U.S. Representative Mike Thompson. She starts the discussion by asking Wood how he reacted when Senate Majority Leader Mitch McConnell suggested that some states might consider declaring bankruptcy to deal with the economic impacts of the pandemic.
I, for one, do not want to see California go into bankruptcy, and we'll do everything we can to remain solvent here. And we've done a lot in the past. We have a rainy day fund we built. We'll be going through that fairly rapidly, I suspect. But California is in a very strong financial position, and I do not see us going bankrupt. And I take offense that that would be a strategy. I don't think that's beneficial for anybody's constituents, and I would expect better, quite frankly.
Congressman Thompson, do you have anything to add to that?
It's just absolutely ridiculous. We need to pull together as Americans. We need to make sure that we all get through this.
You recently voted to pass several relief packages aimed at helping small businesses and hospitals. Can you elaborate on the basics of these bills?
I can. The two most significant pieces of legislation was the CARES Act, which was the third piece of legislation, but that's the one that provided money for small businesses to be able to obtain forgivable loans so they could keep their businesses afloat and their employees hired. It also had money in it for healthcare, and it was a real lifeline for a lot of small businesses. Most recent piece of legislation was an expansion of that. Was about close to $500 billion. And in large part, it went to expanding the Paycheck Protection Program to keep small businesses afloat and keep their employees paid. It also had money in it for healthcare and additional money for testing, which was extremely important because this is a healthcare problem. The economic externality of this pandemic that can be addressed and fixed once the healthcare problem is addressed and fixed. And you can't do that without testing.
Speaking of testing, we've gotten in a number of questions from our viewers concerning testing. And Assemblymember Wood, I want to start with you on this one. What is the testing capacity needed to reopen the state, and where are we now?
Well, that's a big question, and we really don't know what the testing capacity we need to do that. We know it's a big number, and as we ramp up testing throughout the state, and you're going to see more and more of that, I think we'll get closer to that. But we've been asking the question of our own public health folks, and they're still working through the details on that. There is a public-private partnership, a testing task force that has convened, is working on expanding testing throughout the state. They're setting up about 80 more testing sites for being able to gather samples. The challenge continues to be some of the raw materials that go into that, things like swabs, of which we're going to get a lot more of, the reagents that go into, the chemicals that go into actually performing the tests, and so on. And that's just a test to detect if you have it now. There's a lot of work being done by a number of companies and a number of groups on serology testing or blood testing that would be able to tell if you have antibodies to this, if you've had it and have antibodies. We still don't know if that confers lifetime protection or how long the protection might be, but it's important to know who's had it, what that percentage is going forward. And as we start looking at reopening California, testing will be one of the key things that allows us to do that.
And how have you advocated to increase testing capacity?
I've been pushing for it, as has the Department of Public Health. I talk with the Secretary of Health and Human Services on a regular basis. We keep pushing, looking for creative ways to find the pieces of the puzzle we need to do. It isn't hard to push. Everybody's pushing for it. It's just a challenge of materials and logistics, and we'll lick it. I mean, we will. And things are improving dramatically, but it's going to take some more time.
Representative Thompson, do you have anything to add in terms of the testing capacity we would need to reopen the state and where we are now?
Well, I can tell you that we're way behind the curve in the testing. This is all about testing. As Jim said, we need to know where we are before we can determine how to get there. And we've done about 5 million tests. And the goal is to get up between 12 and 15 million by the end of May. And that's still not anywhere close to where we need to be. Jim talked about some of the supply chain problems, and that's absolutely correct. It's not a resource issue at this point. As I just explained in the latest bill, we spent $25 billion on testing, and 11 billion of that went to state and local governments. But there's a disruption in the supply chain, and there's different components to these tests that we need to be able to get. And everybody's pushing to do it. There was a slow start at the federal level. I believe that the Defense Production Act should have been put into place on day one to make sure we had all the supplies that we need. But it's not coordinated at the federal level, which is a problem. There's no way in the world that local governments and state governments should be going on on Craigslist trying to find swabs. There's a much better way to do this, and I think that needs to be operationalized as soon as possible.
Do you think that we're getting closer to resolving some of the supply chain issues? Do you see progress in that manner?
Well, as I say, the goal is between 12 and 15 million tests by the end of May. So that's 7 to 10 million more than we are today. So I guess the answer is yes, but I don't think it's fast enough.
Every week, KBBF does their town hall on Tuesday nights as well, and that's from 5 to 6 p.m. in Spanish on 89.1 FM. And we always bring you an update about what they discussed during their town hall. So this week, Deputy Emergency Services Coordinator Richard Diaz talked about how the county is working on a long-term plan to help deliver food to vulnerable communities such as seniors, for example. And they are also still working with the homeless population, monitoring the number of cases within that population and seeing how many individuals test positive. And at this point, there are no reported cases, as we also discussed on the show. Melissa Valle also talked about the parks order, which goes into effect again at 12 a.m. Wednesday, so that will be in effect tomorrow. Again, KBBF Radio hosts their town hall in Spanish. That's 5 to 6 on Tuesdays. Their radio station is 89.1. So if you're listening on La Mejor, you can also tune into their town hall on Tuesdays. And Darren Lachelle will tell you how you can contact us with questions for the next town hall.
Thanks for joining us for Coronavirus What You Need to Know. Remember, these live town hall specials are broadcast each Tuesday evening at 7 o'clock and air on KRCB TV, KPJK TV, and simulcast on KRCB FM Radio 91. Also, the live Spanish language live translation on La Mejor Radio 104.1 FM. Programs live stream on Facebook Live, YouTube, and on our website at norcalpublicmedia.org. As Adia said, remember to share your questions for our next program by using our contact form at norcalpublicmedia.org/coronavirus. The contact form is displayed on every page of the website dealing with the coronavirus pandemic in our region. On the page, you will find the Frequently Asked Questions section, where the answers to many of your questions may already be shared. Also on that page, you'll find video reports that we've done here on KRCB and KPJK TV, as well as radio reports that Adia and Steve have produced over the past number of weeks. A lot of questions can be answered there. A lot of officials, elected officials, medical professionals, and of course, public health officials have answered a lot of questions on that site. So please do check it out. That's norcalpublicmedia.org/coronavirus. Keep tuned in to NorCal Public Media for the latest news. Thanks for joining us tonight. I'm Darren Lachelle with Adia White for NorCal Public Media.
You're watching Northern California Public Media, made possible by viewers like you.
As the coronavirus pandemic adds uncertainty to our lives, misinformation is stoking fear and anxiety. We at NHK World Japan have launched an action plan to ensure you have the vital information you need to keep you and your family safe. We will give you tools to protect yourself from the virus's economic and social impacts. Our expert journalists across the country and around the globe will break through the jargon, bringing you accurate and up-to-date news. We are committed to providing international viewers with information about the latest achievements and challenges facing those tackling the public health crisis. In a time of unprecedented change, tune into NHK World Japan, a station you can trust.
On this edition of